hemophilia played a big role in that, in that growing up I had a lot more injuries than most. Being a mild hemophiliac, I never really had treatment regularly unless I had a significant injury, which I didn't really have till I was in my early teens. And so because of that, I would kind of get bumps and bruises and hobble, ankle injuries, that sort of thing that I would kind of brush under the rug when I shouldn't have, and hid them from my family when I shouldn't have. And so because of that, I had a lot of exposure to physiotherapy. And when I had some bigger trauma or bigger injuries growing up, those are times where I actually ended up kind of going to the hospital and seeing people more regularly, often because I wasn't taking it as seriously as I should have, at least not as a kid. So what got me into it was the early exposure, I think, that I had throughout the years, which was helpful to me to see what it was like as a patient, which kind of inspired me to see what it would be like as a clinician. And now that I'm on this side of it, it's a pretty great career choice. So it's great for me. And if you like help people move better and work through problems, it might be a good role for you too. I think that it's important to try it and see what you like, because you don't want to spend all this money, time, and effort getting a degree or diploma in something, and you walk in first day on the job and it's not what you thought it was. So my recommendation would be to volunteer and spend some time working under someone or with somebody in an area you think you want to go into before you go ahead and blow a bunch of dollars into schooling and training to do it. If you have an injury that's not improving in a way that you think it should, you got to get help on that. Whether that's your team at the hospital or a local physical therapist, someone you trust, that's when you want to get someone that has a little bit more expertise on things to guide you in what you need to do next and your next steps. Because the last thing you want to do is not do things the right way and have something reoccur and re-injure over time, something that might last a week, could last a month, could last a year, or something that you don't quite take care of could last a heck of a lot longer than that. So ultimately, what I think is if you have an injury and it's not progressing the way you expect very early on, it's time to get help. Or if you don't know what's going on, it's time to get some help. And for me, I might be biased, but I think physical therapy is a great place to start, given that we sort of have our specialty in injuries and getting people back to their normal self. I'd say the most common areas that we see or that we can struggle with is two, and that is muscle bleeds and then joint bleeds. Personally myself, because I have mild hemophilia, I haven't really had many joint bleeds, but I've treated them, and muscle bleeds would be the most common one that people tend to get. That would be a contusion, a bruise, a contact where you get hit in one of these bigger global muscles. And one of the challenges become when you're walking. So for example, if you have an injury on your lower half, in your quadricep, for example, the muscle on the front of the thigh, and you have a bleed that starts when you walk, move, do stairs, go to the bathroom, that muscle is constantly working. And so you are breaking down that clot or that scab that's forming. And in someone with hemophilia, especially if they're not treating, it can be hard to keep up with that level of repair. Whereas you might be able to clot it when you go ahead and move and the muscle starts moving, it can kind of re-injure and re-tear and the bleeding can continue. So I think for me, it's helped me understand my patients when I see them. Whether they have hemophilia or not, working through an injury, I have that experience myself, having multiple injuries over the years that I can then, really empathize with and understand where they're coming from to be able to help them get to those next steps. I think that's important. Sometimes it's hard because ultimately, as a physical therapist, you're never going to have every injury that you see. It's impossible. I hope not, at least. But I think it is helpful when you've experienced, some type of dysfunction, pain, or limitation that you've overcome or been able to work through that allows you to relate to when other folks are in that same state and helps you coach them or bring them through. So for me, hemophilia alone, I've had injuries related to and unrelated to hemophilia over my life, but I think that in general has kind of allowed me to shape my practice and how I view my patients and their recoveries a little bit differently, allow me to relate and help them grow.